potential contamination. The APS should imitate or mimic as possible routine aseptic manufacturing processes and include all critical manufacturing steps. And here we have aseptic operation performed subsequent to the sterilization and decontamination cycles of the materials. For non-filterable formulation, any additional aseptic steps should be assessed. Inert gas should be substituted with air in the process simulation unless anaerobic simulation is intended. You will have separate simulation of individual unit operation. For instance, for compounding or preparation or vaccine manufacturing, you can make this separately. But since you will make the formulation up to the end of the process, filling vials with liquid or freeze drying, this has to be in one row with all the activities. For the lyophilized product, this has been clarified. The process should represent the entire aseptic processing chain, including filling, transport, loading, representative duration of the chamber dwell, unloading and sealing under specified documented and justified condition representing the worst case operation parameters. That means that you do not have to freeze your product. If your sterilization process has a duration of 2-3 days, we have seen that several times. You do not have to perform it for 3 days. You can shorten it. And you have to put your freeze dryer under vacuum and break the vacuum not with nitrogen, but with sterile air. Important as well is if you have to perform some corrective intervention during your processes, during the qualification of the equipment, and the qualification of the validation of your product, you will have the knowledge of what inherent and corrective action you will have to perform during the routing process. Then you will have to carry out this action during your aseptic process simulation. For instance, sampling for in-process control, sampling for QC during the production, and other points like that. So the inclusion and frequency of intervention in the APS should be based on assessed risk posed to the product sterility. That means that this frequency of intervention has to be assessed based on quality risk management. That means you need to have a perfect knowledge of your process, your equipment. And APS should not be used to justify practices that pose unnecessary contamination risk. That means if you have a facility or equipment which is not fully compliant with GMP, you cannot use the APS to say we are not fully GMP compliant, but this is not a problem. Our APS is successful. Based on risk assessment, you will have to identify, we have said that many times now, work under worst case condition. We will have to determine the representative size of container closure combination to be used for the validation. Bracketing or matrix approach may be used, but based as well on risk assessment. And you will have as well to validate the maximum permitted holding times for sterile product and equipment during the aseptic process. That means that your formulated bulk product, bulk vaccine, will have to stay with a low level of bioburden during all the filling process. So the volume filled per container need to be sufficient to ensure that the media contacts all the equipment and component surfaces, and maybe you will have to revert the containers like that the product will be in contact with the stopper. If you are working on different with multiple or different shifts, you will have to manage the APS and design it to capture factor specific to those shifts that are assessed to pose a risk to the product sterility. At the end of the presentation, I have a case study where we have assessed this point. We need to simulate as well normal aseptic manufacturing interruption. Shift changeovers, recharging, dispensing vessels, introduction additional equipment, introduction stoppers and things like that. And you need that the environmental monitoring is conducted as required for routine production and through the entire duration of the process simulation. The performance of end of production of combined APS may be used as additional assurance of investigative purpose. That means that when you work and you are doing, you are working on campaign basis, you need to assess this point in a really important way and make, for instance, the APS just after the end of the campaign. Like that, you will have information on your robustness of your process during the campaign. Now, APS should be performed as part of the initial validation with at least 3 consecutive satisfactory simulation tests that cover all working shifts that the aseptic process may occur and after any significant modification to operation practices, facilities, HVAC system, whatever. Normally, APS should be repeated twice a year. Each aseptic process, each filling line, each shift. Each operator should participate in at least one successful APS annually. consideration should be given to performing an APS after the last patch prior to the shutdown. This is the same case than for campaign. These are quite strong requirements. And in your facility, you will need to review your aseptic process simulation schedule. Otherwise, I've made some calculation with for some companies, and based on this, they will never product any drug product. They will do only aseptic process simulation around the year. That means that industry need to think carefully on how to make this aseptic process simulation based on their knowledge, the process knowledge, their procedures, and everything around the processes. Now, we have said that for conventional filling lines, the requirement could be higher. When we have manual operation, each type of container closure and equipment should be initially validated with each operator, not shift. Each operator participating in at least 3 consecutive successful APS and revalidated with 1 APS approximately every 6 months for each operator. And this is a big difference from what is required for isolator or wraps, because each operator should participate in at least 1 successful APS annually. And here it's every 6 months, each operator. That means that you will have to consider this point really carefully. I've said that we do not need to remove the conventional filling lines from operation with this new annex. Maybe with the WHO organization, we will have some flexibility, but for sure, we will have such high constraints that we will need to consider the point. The size of the aseptic process simulation, it minimum 5,000 units to 10,000 units. If for small batches, the number of containers will be the full batch. Once APS is carried out, the units should be agitated, swirled, inverted before incubation. All integral units from the APS should be incubated and evaluated. Included units used with cosmetic defects and those which has gone through non-destructive in-process control check.